So in case of trematodes, there are many things which are common and we call them rules of common and rules of exception.
Sir, you are not
Firstly,
audible.
you will find man is always present in most of the trematodes except
Sandeep?
prostogonimus. Prostogonimus, where
It is low. Sir, we can't hear anything, sir.
ventriculus. Then intermediate
Yes, sir.
flows, that is first always
Hello?
smooth,
Excuse me, sir.
and the
Excuse
second,
me, sir.
hello,
Yes, sir, we can't hear anything.
hello. Changes from fluke to fluke. So fasciola, fasciolopsis, and cystosomes like Dicrocilium, Opisthorchis, and Paragonimus. All these flukes they have different second intermediate host. At infective stage, next feature is infective stage. Metacercaria is common for all the flukes except one, that is your cystosome. Cystosome. They have cercaria as the infective stage. Then one more common feature is about the eggs. All have their eggs with one operculum. And the trick or mnemonic to remember is DOSE. DOSE. D for Dicrocilium dendriticum, O for Opisthorchis, and S for cystosomes. Other than these three, Dicrocilium, Opisthorchis, and cystosomes, rest all are unembryonated. This E stand for embryonated. Embryonated. So DOSE. So these are the three flukes which are having embryo inside the egg, that is embryonated egg. Other than these three, rest all flukes are unembryonated, like your fasciola, amphistome, uh, paragonimus. All other are unembryonated. Then, in case of trematodes, there are larval stages. There are some larval stages. We call them MCR. MCR, Cercaria, Metacercaria. So, what is M? That is Miracidium. Miracidium is the structure which is having some eye spot and cilia around its body. This is the Miracidium. Then we have this C stand for cyst. A cyst which contains spore. So we call it sporocyst. And R for radia. And this is Cercaria and Metacercaria. So these are the larval stages which you will find in all the life cycles where some of the stages like this radia absent in DD, it is absent in cystosome. And this metacercaria only absent in cystosome. So radia or this cystosome having absence of metacercaria and radia both absent. This was the MCQ in 2020, your veterinary science exam. That in case of life cycle of cystosome, which two stages are absent, one is radia, one is metacercaria. So next question will be that Dicrocilium dendriticum radia is absent. So these are the following larval stages: MCR, Cercaria, Metacercaria. Then starting with our first family, that is Fasciolidae. There are two members. One is Fasciola and second is Fasciolopsis musca. In both the life cycles, there are only two differences. First difference is the definitive host is man plus cattle, buffalo, sheep, goat, and here man plus pig. And the second difference is Fasciola is a liver fluke and Buscae is a intestinal fluke. And this was the MCQ in 2019. Which of the following is not a liver fluke? And the option was, or answer was, Fasciolopsis buscae. It is an intestinal fluke. So if we compare the life cycle of these two, then this is your definitive host. This is your definitive host. That is man plus cattle, buffalo, sheep, goat. Then from the definitive host we come to first intermediate host, always snail. Then we come to second intermediate host, that is the intermediate host which changes with every flux. And the last is the infective stage. Okay. So in case of fasciola, this is the bile duct. This is the bile duct where adult liver fluke is sitting. And what comes out? Egg. And these egg are DOSE. These egg are not the member of DOS family. It means they are unembryonated. Operculated and unembryonated. Why unembryonated? Because not a member of DOS. So from this unembryonated, it will become embryonated. Then what comes out? Miracidia. Hatching of egg lead to release of miracidia. This stage will enter into the snail. Miracidium enter into the snail and it transform into CRC, that is sporocyst, radia, and then cercaria. This cercaria comes out, and this cercaria, this is the cercaria. In case of fasciola or Fasciolopsis buscae, in both the cases, the second intermediate host is plants. In case of fasciola, it is fresh vegetation, or in case of Fasciolopsis buscae, we can say these are the tuber or nuts. But these are also plants. So this cercaria, it will convert into MC, metacercaria, transform into metacercaria. And this is the infective stage which is eaten by your definitive host, cattle, buffalo, sheep, goat. So metacercaria, which is attached or present on the plants or vegetation that is eaten by the animal, it will enter into the body of the animal and through the GIT, it will reach ultimately its predilection site, that is bile duct. So before reaching to bile duct, it has to cross from the intestine, it will cross and reach to liver. So if you look at the pathogenesis, there are three forms of fasciola: acute, subacute, and chronic. Acute form is common in sheep. and chronic form is common in cattle. This acute form, these immature flukes, they enter into liver, and what they do, they migrate like this. They migrate in all the different directions, and sometimes they rupture the capsule also. So these migratory paths that may lead to excessive bleeding, that may lead to excessive bleeding into the peritoneal cavity or surrounding this. So the most important pathogenic part is the migrating tract inside the liver because of the immature flukes. This is the characteristic feature found in fasciola, and this is absent in case of fasciolopsis pascae. So there is one question that fasciolopsis pascae is less pathogenic than the fasciola. Why? Because in case of fasciolopsis, these immature fluid, this migratory phase is absent. There is no migration, less pathogenic, and clinical signs are not that much important. So the immature fluke migration is very important in case of fasciola. And this adult fluke, this is sitting inside the bile duct, and it causes irritation to the bile duct. That may lead to cholangitis or that may lead to hyperplasia. Hyperplasia, the bile duct inflamed, then chronically it will fibrosed. Because of this fibrosis, it becomes so hard if you try to cut with a knife, it will be difficult for you to cut the bile duct because of calcification and because of this fibrosis. So we call it clay pipe stem liver because of this fibrosis, because of this calcification. So because of the adults, this feature is there, and because of the immature one, there are migratory tract present. And the one more thing, in case of liver, if there is some anaerobic environment is created, anaerobic,
This
that
clay pipe stem liver in chronic or acute
yes,
condition.
yes, this is in case of chronic condition.
Okay.
Obviously chronic condition, because in case of acute condition, these are the large number of many hundred and thousands if metacercaria are ingested, and that may lead to immature flow that damage the liver. Hemorrhagic tracts are there, and but this is the case with the uh, chronic condition where it may lead to slowly irritations. Why irritation? Because if you look at the structure of your fasciola, there are spines. There are spines. The cuticle of fasciola carries spine, and these spine cause continuous irritation. And if you continuously irritate someone, that may lead to the inflammation. The first acute, then chronic. So this was about the fasciola. If we compare this with fasciolopsis pasca, then same we draw the animal, but this time this is the intestine, small intestine. This is the intestine. And the intermediate host is always snail, and the second is again this is the plant. So the animal is changed, that is pig. Location is changed, that is small intestine. So these two are the difference between the fasciola and fasciolopsis. Other all the things are same. Like from the intestine, it will release the egg unembryonated because it is also not a member of those. Then become embryonated. What comes out? Miracidia. See, RC Cercaria comes out, and this Cercaria having tail, it will lose its tail and sit on the vegetation. And this vegetation is known as tuber or nuts, which plant mostly calotropes. If small, in case of human being, if small childrens they eat the tuber, these tubers, then after eating, it will come into their small intestine, then it will become adult, again egg, MCR, Cercaria, Metacercaria, and the life cycle goes continuously. So, in case of Fasciolopsis muscae, the small intestine is affected. There may be enteritis, there may be diarrhea, emaciation, anemia, all these things, weakness, like this. So one MCQ that they always ask about the fasciola is the drug of choice. What is the drug of choice? There is one drug famous, that is triclopentazole. Tricla. In one competitive exam, they have asked the dose rate of sheep and dose rate of cattle. So it's very simple. Count the letter 1, 2, 3, 4, 5. Make it double, that is 10 mg per kg. Similarly, in case of cattle, 1, 2, 3, 4, 5, 6 into 2, 12. So the dosage for the sheep is 10 mg per kg and dosage for the cattle is 12 mg per kg. Then about the diagnosis, there is one MCQ like operculated egg, yellowish egg. So which cestode, which cestode have eggs similar to your fasciola? That is operculated, yellowish color. The answer will be D latum. So D latum and spirometra. These are the two primitive cestode having most of the features they similar with the fasciola. So if they ask you that which of the only cestode that having eggs similar to fasciola, your D latum. Both are operculated, both are yellow, and both are one more thing. Both are unembryonated because they are not the member of those. So next fluke is the DD, that is Dicrocilium dendritica. Similarly, they have some definitive host, then first intermediate host, and then the second intermediate. First is always snail, and second in this case is the ant. Cat, man is always there, dog, cat, pig. Now, this Dicrocilium dendritica, this is also
Sir,
known
you
as
are not
fluke.
audible.
This is also known as fluke. The adult fluke is sitting inside the white duck. What comes out egg? The egg, that is D for egg, E for embryo. So this is embryo. What
Say not audible, sir.
enter into the this egg is ingested by the snails.
Sir, can you start from the definitive host?
R is absent in case of dengue. So point is secretary.
Sir, your voice is coming low.
So these but these bacteria they always survive. They are
Sir,
very healthy.
we can't hear you.
They are very healthy.
Hello, sir. Hello, hello.
Hello. So these bacteria what they can survive, they are in number of 300 to 400. Okay.
Sir, your voice is coming low, sir.
Hello. Hello. Hello.
Sir, your voice is coming very low, sir.
Just a moment. Hello.
Yes, sir, we can hear
Hello.
you.
Hello. So first larval stage was Miracidia, MCR, then Cercaria, then Metacercaria. But in case of Dendriticum, this is absent. All other stages they are present. So this is your MCQ. That which larval stage is absent in the Dendriticum. Second MCQ is about the snail. From the body of the snail, what comes out? In 2020, one competitive exam they have asked, from the body of the snail, what comes out? This slime balls. Then, if you look at the second intermediate host, that is ants. They eat up this and convert into metacercaria. That is always infective form, and this is eaten by the animal. Then again what comes out? Egg. And these eggs are embryonated. And the cycle goes on. So
Is
this
there any
was the
peculiarity about the metacercaria from others?
metacercaria. In case of dendritic, the peculiarity they have different types of cercaria, not metacercaria. Metacercaria they are the uh, cyst-like structures. And why this? Okay, suppose this is the cercaria. Some have simple tail, and some cercarias have like this bifurcated, what you call furcocircus cercaria, and some have pigment multiple cercaria pigmentata. They lose their tail and to survive under adverse condition, adverse environment, they become metacercaria. And this metacercaria, along with the food, that may be grass, that may be tubers, nuts, and other things, it will be eaten up. And this metacercaria, when it enter into the, suppose this is the ingested by and duodenum. Inside the duodenum, what comes out from the bile duct? Bile. So because of biles or some enzymes, this outermost wall is removed. And we call this process excistation. Means your cyst is X, means it is broken down and it is containing inside it, that will comes out as a form of either embryonated egg if it is a member of dose, or it will come out as unembryonated egg. Then the next is amphistomes. The life cycle of amphistomes is very similar to the fasciola. Why? Suppose this is the definitive host. Again, first is always male and the second is this time fresh vegetation. That is your plants. That is your plants. They are the second intermediate host. So there are three trematodes, there are three flukes where you will find plants as a second intermediate. First is fasciola, second is Fasciolopsis fusci, and the third is amphistome. Except these three, you will not find plants anywhere in the life cycle of the trematodes. So in this case also, the first is snail. As amphistomes are found in the rumen or stomach, what comes out from the body? Egg. It is a member of dose or not? It is not a member of dose. It means the egg is unembryonated. This is unembryonated. So once this unembryonated egg, it comes out outside the environment, it will become embryonated, then it will hatch out, comes out as Miracedia, then MCR, then C, Cercaria, and this time the peculiarity ICAR 2018, they have asked which of the following Cercaria is known as having pigment or pigmentata. This was your MCQ in 2018. The Cercaria is having pigments, pigmentata. So this thing are common in all your trematodes, that inside the body of snail, most of the time you will find three things: C, R, C. Sporocyst, Radia, Cercaria. Cercaria leaves the snail, it will come out, and this Cercaria will be converted into metacercaria. And metacercaria with the vegetation, the animal again eat, again reach the predilection site, that may be stomach, rumen fluke, then eggs, then Miracidium, C, R, C, Cercaria, and the plants. So with the amphistome, they have asked two MCQs. First MCQ was Cercaria pigmentata. Second was second intermediate host, vegetation. And third MCQ was the bottle jaw condition, where if inside the body there is hypoproteinemia, that may lead to accumulation of fluid in the area of jaw. So this bottle jaw condition is present in flukes. There are two flukes, and both the flukes have asked in 2018, that fasciola and amphistome. In case of fasciola and amphistome, there are two flukes. You will find the condition known as bottle jaw because of hypoproteinemia. So in case of amphistome, if you look at the pathogenicity, these are the immature flukes which are most pathogenic. The adult fluke are less or least pathogenic. And these immature fluke, if they attach themselves to this portion known as intestine, what they do is, this is the mucosa. They remove the mucosa, eat the mucosa in the form of plug. So we call them, immature flukes are known as plug feeders. This was the MCQ in ICAR 2070. Which of the fluke is known as plug feeder? So immature fluke are known as plug feeder. They feed, they eat the intestinal mucosa in the form of plug, that is plug feeder.
So can you say the common name of the flukes along with each one?
Common name of
Flukes.
flukes. The amphistome are known as conical fluke, or you can say that are known as stomach fluke, ruminal flukes. These are the synonyms we use for them. And most of the flukes, if you look, they are like this, dorsoventrally flat. But these amphistome, they are thick, they are fleshy, they are thick, and they are fleshy. Even okay, they are thick and fleshy. So they are also known as conical or ruminal fluke. Then coming to paragonymous. Para means side and gonymous means gonads. If this is the body of a parasite, the gonads are present on the side, like testes or ovaries. They are present on the side. So paragonymous. This is known as, common name is lung fluke. So P for paragonymous, P for pulmonary fluke. In case of paragonymous, first intermediate host is also snail. Suppose this is the definitive host and this is the first intermediate, always snail. But in this case, the second is crab or crayfish. So this is the lung fluke. From the body of the animal, what comes out? Egg. And this is not a member of toes. So it is always unembryonated. So the egg which comes out is unembryonated egg. Then this become embryonated. Hatching occur. What comes out? Miracidium. It will enter the body of the snail. That is, M will transform into C, R, C, Cercaria. So what comes out? That is the Cercaria. This Cercaria will enter into the body of crab or crayfish. And these uncooked or raw crab or crayfish eaten by the definitive host. Then they will reach into the lungs. Inside the lungs, the adult will release some egg, and these egg will come out into sputum, or they may be swallowed. Once it's swallowed, they will enter into the intestine, then again come out into egg, Miracidia, MCR, Cercaria, crab crayfish, that is your second intermediate host, then uncooked, eaten by the definitive host, that is your man, dog, cat, and then again it will So the pathogenesis is related with the lungs because it is known as lung fluke. So the pathogenesis is related with the lungs. So in case of lungs, this parasite in the lungs, this is the place where the parasite is sitting. So this parasite causes pneumonia. This may cause bronchiolitis, inflammation of bronchioles, and it may lead to some, because it is parasite, so eosinophilic granulomatous reaction. So these are the three pathogenesis related with the paragonimus. Pneumonia, that is lungs are affected, bronchi if affected, they are known as bronchiolitis, and there is eosinophilic, that is infiltration of the eosinophil that may lead to granulomatous reaction, and the diagnosis will be, one of the diagnoses is sputum. In the sputum you will find egg, and this is not a member of dose, so the egg will be unembryonated. Egg will be unembryonated, and in case of sputum you will find the same egg. Next, there are two flukes. One is known as Opisthorchis and one is Clonorchis. In both the flukes, everything is same. Only difference is definitive host. This is of your veterinary importance, that is dog and cat, and Clonorchis is related with the man. So this is the difference. Other things are same, like eggs are. Again, it is a, now this is a member of DOSE. DOSE. O means Opisthorchis. So the egg is embryonated. This egg is embryonated. The morphology of these two parasites is like this. They say this posterior part is white and this posterior part is not white. So the posterior part is white. And one more MCQ, in one exam they have asked about the bladder. About the bladder. This bladder is Y-shaped. In case of Opisthorchis, the bladder is Y-shaped. So these are the differences between Opisthorchis and Clonorchis, based on their morphology or their host. Other things are same, like egg and first intermediate host, they are same. Second is also same. So the life cycle. Again, this is your definitive host. The fluke is present in the bile duct. This is present in the bile duct. Then comes with your first intermediate or always snail. This time the second one is fish. This time the second intermediate host is fish. So from the body of the definitive host, eggs come out, and these eggs are member of DOSE. So these are the embryonated. So embryonated eggs release with the stool or feces, and these eggs are taken up by the snail, and where Miracidia and C, then R, then C, Cercaria. Then what comes out is the Cercaria. So these Cercaria, they enter into the body of fish and they convert into the Metacercaria. And if your definitive host eat uncooked fish, then it will enter into the body predilection site, bile duct, and again release of egg, MCR, then cercaria, then metacercaria in the fish. This cycle goes on. So the MCQ asked with this cycle in the exam that it was this is the bile duct. So in case of clonorchis or opisthes, the pathogenesis is related only with the bile duct. You can say cholangitis, or there may be the most important MCQ is cholangiocarcinoma, bile duct carcinoma. This is your MCQ. That the cancer of the bile duct is caused by the fluke, that is cholangiocarcinoma. So this was about the opisthoarchis. Next is your prosthogonemus. Prosthogonemus is related with the poultry, and the predilection site oviduct and bursa. So prosthogonemus is a poultry fluke, or you can say bird fluke, and the predilection site where you find this fluke will be oviduct or bursa. Again, this fluke is also not a member of dose family. So what kind of egg will come out? Unembryonated egg. Egg will be operculated and unembryonated. The first is always snail. So inside the snail, same thing, MCR. What comes out? Cercaria. But the MCQ related with this point is R is absent. It means radius stage is absent. So we have three flukes: Dicrocilium dendriticum, prosthogonemus, and the cystosome. In these flukes, radia is absent. So radia is absent, what comes out? Cercaria. Then these birds, what they eat? They will eat fly. So your second intermediate host is the dragonfly. And mainly if they ask you, then answer will be nymph stage. So this cercaria will enter into the body of fly, and this fly eaten by your birds. And then again it will reach to its site, oviduct and bursa. So this is a small life cycle of the prosthogonemus. Then coming with the pathogenesis. Pathogenesis is related with the oviduct. What happens in case of pathogenesis? Suppose this is the oviduct, and inside the oviduct, what form? Egg. And this egg, because of the adult parasite, there will be some kind of irritation. That irritation may lead to reverse peristalsis in case of oviduct. And this, because of this reverse peristalsis, the egg which is formed inside the body of a poultry bird, it will broken out. And the part of the egg, some part comes out through the vent, and some part of the egg will enter into the peritoneum. So this peritoneal entry of the egg or egg material, broken egg material, that may lead to your MCQ, that is aseptic peritonitis. ICAR 2018, this was the MCQ. Aseptic peritonitis is caused by the prosthogonemus. Why? Because of the reverse peristalsis. The eggs are broken down into pieces, That material may come out through the vent, or that material may enter into the peritoneal cavity, lead to aseptic pressure. This side, the material which comes out is, this material is milky white in color because of albumin. So you will find milky discharge. The clinical sign will be milky discharge from the vent, and the feathers which are present around this area, they will glue together, and you will find white feathers which are glued together at the anus. And second is milky white discharge. The third clinical signs, because this egg content enter into the peritoneum, so because the content has entered into the peritoneum, the peritoneum will become like this. It means if you look at the body of some bird, they are like this. And these birds are nothing but your penguin. This was the MCQ in 2018, that penguin like sitting or squat is seen in case of which fluke? Prosthogonemus trematode. Why? Because of this accumulation of fluid, the abdomen becomes so much distended that it will look like a penguin. So these were MCQ related with this. Your last trematode is cystosomes. What is special about that? Remember this S. This S will tell you 4 to 5 MCQ. Second, intermediate host absent. Then again S. Sexes are separate. Means this is the male and it carry one canal. Okay. This canal is known as gynecophoric canal. In this canal, you will find female. So the female is sitting within the body of male. Within the body of male. And this is the gynecophoric canal. So both male and female are separate, and female is sitting within a canal inside the body of animal, and the length of the female more than the male. This female is more lengthier than the male. So this is one of the MCQ asked in some competitive exam there. Which of the following fluke or trematode carry gynecophoric canal? And what is present that? So you can remember from this tree, gynecology. Gynecology is related with the female. Gynecology is related with the female. So in the gynecophoric canal, female will be present. Next, second intermediate host absent. Sexes are also absent. Then if you look at the sound of C and S, this is also similar. That is Cercaria. Cercaria is the infective stage. Infective stage. And metacercaria absent. Other radia is also absent. Operculate, that is lid, is also absent. What is present? Spine is there. S for spine. And the last exception, that is drug of choice. That is praziquantel. Praziquantel. which is similar with the cestode. So most of the features, they do not match with the trematodes. So this is a blood fluke which is full of exceptions, which is full of MCQs. Then the life cycle, if you look at the life cycle of the cystosomes. Again, we have definitive host. First is always snail, but the second is absent. It means in the life cycle of the cystosome, we have only one intermediate host, that is snail. So remove the second one. So this is your definitive host. From the definitive host, in this case, feces and urine, both are important, because in case of human being, there is one cystosome, that is cystosome hematobium, that is present with the blood, related with the bladder. So the eggs also come out through the urine or the feces, and these eggs are member of your dose. As for cystosome, it means these eggs are embryonated. These are embryonated eggs. Again, hatching occur, what comes out? Miracidium convert into MC sporocyst, then radia is absent, it will convert into cercaria, and the special feature, ICAR have asked 2-3 times, that cercaria is bifurcated. The tail is bifurcated. Tail is bifurcated. This will enter your second MCQ. That is,
Sir, we can't hear you.
Again, one step. Hello. Hello. Okay.
Okay.
So, cystosome. The definitive host, from the body of definitive host, through the feces or through the urine, what comes out? Egg. And these egg, again the first intermediate host is snail, that it will become miracidium, then sporocyst, there is no radius state, it will become cercaria. Cercaria is having bifurcation of the tail, Furcocercus cercaria. We call it Furcocercus cercaria. This cercaria enter into the body of the definitive host through penetration of the skin. So these were 3 MCQs. One is radia, one is Furcocercus cercaria, another MCQ is skin, and then it will enter, and the last MCQ is your embryonated egg. And one more MCQ they will ask, which of the following trematode will come out through the urine? Although it is not present in the animal, but it is present in human being. But in MCQ they will ask cystosoma hematobium. So this is about the cystosome. So inside the body, if we enter inside the body of the host, there is one more MCQ that is related. That is, once this cercaria, okay, this bifurcated cercaria, it will enter, then it will convert into cystosomula. Cystosomulae. That cystosomulae circulate inside the body within the circulation. From the circulation, that may enter into the urinary bladder. Suppose this is urinary bladder, it will enter, and this is the predilection site in case of cystosoma hematobium. Then through the urine, what comes out? Egg. Second case, from the blood, it may enter into your mesenteric vein. Through the mesenteric vein, again intestine, and then through the feces. What comes out? Egg. So these egg may be present in urine or feces. Then the cycle again: miracidium, sporocyst, noradia, cercaria.
In all
Again,
cystosomes,
yes, in all cystosomes.
no, the egg is present in both urine and feces.
In case species-wise, there is difference of the site. If you look at like Cystosoma japonica, spindle, there are many species. In case of cattle, there is one Cystosoma nasale. This Cystosoma nasale is related with this is the nasal cavity. Suppose this is nasal cavity. Inside the nasal cavity, what will enter? That is egg. These egg in the nasal vein, they lead to inflammation. And that inflammation may cause some cauliflower-like growth. And because of this cauliflower-like growth, there is difficulty in respiration. And that difficulty in respiration will lead to snoring. So this is called snoring disease, Cystosoma nasale. So after skin penetration, it may reach to your nasal vein. The eggs will cause irritation, and that may lead to inflammation, and then in eosinophil infiltration monocytes, that may lead to a granulomatous reaction, that may lead to a cauliflower-like growth, and these growth obstruct your airways and lead to respiratory difficulty, causes snoring disease. And this disease is more important in cattle than buffalo, because buffaloes are more resistant to such kind of parasite. So if they ask you, Cystosoma nasale is merely a fluke of, answer will be cattle. If cattle is not given, answer will be buffalo. And with this, the pathogenesis is cauliflower-like growth, and that growth may lead to the sign snoring, the snoring disease. So this is related with the Cystosoma nasale. Other cystosomes, that may be intestinal. If the cystosomes reach through the mesenteric vein into the intestine, that adult may lead to the irritation here, and that may lead to enteritis, that may lead to your diarrhea and emaciation, like this. So they may present in the nasal vein. If they are present in the bladder, comes out through the urine, or if present in the intestine, lead to enteritis, lead to diarrhea, emaciation, and in case of young ones, there may be death. And the drug of choice is one drug, that is Parasitology. Quantum. This is the tag of choice. So, if we summarize these all trematodes, then what we find that all the trematodes, one side we have fasciola, fasciolopsis, busci, DD, paragonimus, we have prosthogonymous, then we have amphistome, opisthorchis, clonorchis, and one side we have cystosome. That are your bloody flukes. They are the bloody flukes because they are full of the exception. And these are all the flukes. What is common? Your first intermediate host, that is always and always snail. In which flukes radia R is absent? This is your Dicrocilium dendriticum, and this is your prosthogonymous and your cystosome. 1, 2, 3. So in which of the flukes metacercaria is absent? Only one, your cystosome. And in which of the flukes vegetation, fresh vegetation, or you can say plant, is the second intermediate host? Answer will be fasciola, busci, and your amphistome. Okay. And if they ask you in which of the parasite or flukes bottle jaw condition is present, answer will be fasciola and amphistome. In which of the flukes aseptic peritonitis is found? Answer will be prosthogonymous. In which of the flukes liver is affected? Fasciola, Dicrocilium dendriticum. Out of these, which is more pathogenic? Fasciola. Why? Because there is immature migratory phase. In case of DD, immature migratory phase is absent, so no pathogenesis. In case of paragonimus, lungs are affected. That may lead to your sputum, rusty brown color egg in the sputum or egg in the feces. Then, okay, opisthorchis and clonorchis. What is special about the clonorchis? Cholangiocarcinoma. That is cancer of your bile duct. Then which of the following fluke is intestinal fluke? Fasciolopsis busci. Which is stomach fluke? Amphistome. Which one of the fluke looks like grains of a pomegranate? Reddish, pinkish color. Amphistome. That was MCQ in competitive exam. Amphistome agar, reddish or pinkish in color. So these MCQs were asked about the trematode. And related with the egg of the trematode, just remember. Ask.
Sir, if schistosoma is affecting liver, in chronic cases, schistosoma is affecting liver.
In chronic cases, what happens?
Yes, schistosome will affect the liver.
If cystosome affects the liver,
yeah.
If you look at the site of the cystosome, you will find it will present in the portal vein, mesenteric vein, present in the nasal vein, present in the urinary bladder. So if it enters the liver, then which phase will enter? Obviously cystosomular. And cystosomular will enter, or it may cause damage, or that may lead to your hepatitis. But there is no chronic stage in case of this cystosomes. Mostly acute stage is there, and that is because of this cystosomulase. If they enter the liver, they will cause hepatitis or damage to the liver. That may lead to the consequences of hypoproteinemia. Mainly the albumin will decrease. But the more important is these things, which species present in portal vein, which is present in mesenteric. And one more thing with the Cystosoma is cercarial dermatitis. One more thing is the cercarial dermatitis CD, that is hypersensitivity reaction. And this hypersensitivity reaction is because of the cercaria. It causes hypersensitivity reaction. And these are mostly of non-human origin. And that is your avian cystosome. Non-human means avian cystosome. They causes cercarial dermatitis, also known as cercarial itch, rice paddy itch. Because these cercaria, they penetrate the skin and they cause cercarial dermatitis. So with the cystosome, species and their location is more important. And from which organ egg will come out, that is more important. Only this much is sufficient for ICAR exam. Then,
Doubt, sir.
ask.
Sir, which trematode causes anemia, sir? Severe anemia.
Which trematode causes severe anemia? If you look at the fasciola, it causes loss of 0.5 ml blood per fluke. That is more than any other flukes. It causes loss of 0.5 ml. That is maximum.
So one more.
Ask me.
Which trematode will cause protein losing enteropathy?
Which trematode causes protein losing enteropathy? Okay. The term is protein losing enteropathy. Entero, that is something which is related with your intestine. If you remember, your amphistome, they are the mucosal plug feeder. They are the mucosal plug feeder. If they feed mucosa in the form of a plug, that may lead to damage to the capillaries. And because of this capillary damage, more of the protein that you will lose in the feces. That is related with your amphistome. Because of this plug feeding habit, that may damage the capillaries, and because of that, you lose the proteins in the through the intestine called enteropathy.
That is, we can specify say that it is immature amphistome.
Yes, immature one, obviously, because matures are less pathogenic.
Pit or Giller.
There is one term what you call pit to gillers. These are some synonyms they have given for these enteropathies or loss of proteins, immature flukes. Okay. Then starting with the cestode. As we have divided trematodes into two parts, one with exception, common and one with exception. Similarly, we divide the cestode into two parts. One is pseudo, that is false cestode, and one is true, that is cyclo. These are known as pseudophilidae. Why they are false or they are different from the true or other cestode? Because there are few characteristic features or there are few part of their life cycle, they are similar with the trematodes. The first member of this exception, that is your D latum. That is your D latum. Diphyllobothrium latum. Diphyllobothria means there are two longitudinal grooves. These are bothria. These are your windows. One is in front or one is behind. There are two bothria. Other true one, they have scolex, neck, then these segments, which may be divided immature, mature, gravid. But in case of these primitive one, these exceptions or false, they have bothria, longitudinal groove, they have windows. And through these windows, what they are eating? Vitamin B12. So they lead to deficiency of B12 in case of definitive host. That is known as pernicious anemia. So with the D latum, why it is so different from other cestode? First is there are two intermediate hosts. Most of the cestode, if you look at the Tinea solium, Tilia sessinata, Hydatidina, multiceps, they mostly have one intermediate host. Solium is having pig, sessinata having beef, that is your cow, but this D latum having two. First is cyclo. First is the cyclo, and second is your fish. So similar to trematodes, trematodes also have two intermediate hosts. First is always snail, and second which vary from trematode to trematode. So this cestode is also having two intermediate hosts. The first is cyclo and the second is fish. So this is one which is matching with the trematode. If you look at the second similarity, that is your egg. This egg of D latum very similar to fasciola. Why? First, it is unembryonated. Second, similarly yellow in color. Third is operculated with this slit. So all these features of egg, they are similar with the fasciola. And the two intermediate are similar with your trematode. So starting with the life cycle of D latum, similar as we discussed for trematodes, again we will make our definitive host. Then we'll make our first intermediate host, and then the second, that is your fish, and first is your cyclops. But the difference between trematodes and cestode is that in case of trematode, the larval stages were known as miracidium, C for sporosis, then R radii, C cercarian, metacercarian. But in case of this, the adults are present in your intestine. Then from this, what comes out? Egg. And the eggs are similar with the fasciola, that is unembryonated. So this egg will lead to development of this L1 stage. So first these eggs are ingested by the cyclops. Then it will develop into L1. And the L1 is known as CORA, coracidium. And it will transform into L2. This L2 will come out from the cyclops. And this L2 is procercoid. And then this L2 will enter into the body of fish. L2 will convert into L3. This L3 is your infective stage. And how to remember L3? If I write plerocercoid, this is plerocercoid. This LE, L, make the E like this. You will find L3. So they will give you three options. Which of the following is an infective stage in case of dilatum? Parasitium, procercoid or plerocercoid. So from the name itself you can derive LE, that is L3 is the infective stage. So the pathogenesis, you can remember the pathogenesis like this. This is your Diphyllobothrium having two bothria, and there is vitamin B12. So it will compete with the host. There is a competition between host and your dilatum. Dilatum consume all the B12 that may lead to your pernicious anemia. Pernicious anemia. So this is the pathogenesis in ICAR 2017 or 18. Two times they have asked that which of the following Cestode related with the pernicious anemia, or also known as macrocytic anemia. So, similar to dilatum, there is one more member, spirometra. About the spirometra, there is only one MCQ, that is second intermediate host. The second intermediate host may be frogs, amphibia, reptiles, birds, and mammals. These are the second intermediate host of spirometra. And in case of this, the L3, which is not these days we call it plerocercoid. Earlier it was known as sparcanum. Because of this, the disease was known as sparcanosis. So these are two MCQ related with spirometra. That is a member of the dilatum family. Second intermediate amphibia, reptiles, birds, mammals, all. And the L3 plerocercoid was known as sparcanum, and that may lead to your disease sparcanosis. Then starting with true cestodes, means those cestodes which have their head, and that head is called scolex. Then they have neck also. Then their body is divided into segments. They keep on shedding what's gravid, fully mature segment. Immature becomes mature, then gravid segment. So they keep on shedding these segments. So these are your true. And on the scolex they have hairs, and these hairs are known as hooks, present on the head, scalp. That scalp is known as rostella. So like this. This is the structure of these cestodes. Having scolex or having hairs like hooks, then neck, then body, which is segmented, immature, mature, gravid, keep on shedding outside, and these are your cestodes. So starting with Taenia family, okay, Taenia solium, Taenia saginata. In the booklet, a very beautiful life cycle is given of solium and saginata. So first we'll see what is the difference between these two. The cycle is very simple, that is the definitive host, one intermediate host. This is the cycle. One definitive host, one intermediate host. So first of all, there are some differences that asked in 2019 ICAR exam. That which of the following out of these two do not contain hooks? It is solium or saginata. It means this is your parasite. These hairs, these are absent in case of your solium. In case of solium, these are absent. So this was the MCQ in ICAR 2000. Books are absent, they are present. How to remember this? There is one term, sagineta. So they have said Tata to the hairs. So these are absent and these are present here. So there is no hair in case of sagineta. So this was the MCQ. Hairs are not present and solium, these are present. Second MCQ about this sagineta was, which one is larger in size and which one is smaller in size? Then how to remember that? Sagineta and your solium. If you remember, the intermediate host is cow and here intermediate host is pig. So out of these two animals, the body of which animal is big? Suppose this is the pig. Cow is bigger than pig. So Taenia sagineta is the largest tapeworm and this is smaller than the sagineta. So if you compare the size of a cow and a pig, so sagineta is big and solium is small. Then third difference between these two is number of egg, 80,000. Why? Because this is the big one. And make it half, it is 40,000. The next intermediate host difference is there is cow, there is pig. And the larval stage is called Cestode. We call them Cestode. That is cystocircus. Because there is cow, we call bovis. And in case of pig, this is known as cellulose. This is known as cellulose. So cystocircus bovis, cystocircus cellulose. The next difference, very important difference about the egg. In 2019, they have asked MCQ about the gravid segment. About the gravid segment. Out of these two, sagineta or solium, this is your parasite. It is shedding the gravid segment. This gravid segment is motile in case of sagineta. This is non-motile in case of your Taenia solium. This was asked in 2019. Next is the differences about the eggs. In case of human, here eggs are not infective. Eggs are not infective. In case of this, because of poor hygiene, these eggs may be, because of poor hygiene, they may enter, taken up through their dirty hands, they may enter into the body and they may cause infection. So we call this auto-infection. This is known as auto-infection. So auto-infection out of these two is present in Taenia solium. Why? Because of the eggs. Because of the egg. So eggs are not infective. Eggs are infective. Because of this, it leads to auto-infection. So these children, because of the unhygienic condition, dirty hands, they enter. Or the second case may be these eggs, because of reverse peristalsis, again they enter into the body. That may also lead to auto-infection. So in this case, In this case, the human or man is acting as definitive host as well as intermediate host. Because of this habit, it is acting as intermediate host. But in this case, saginator, always the man will be definitive host. But in case of Taenia solium, man will be your both DH as well as IH. These were also asked MCQs. So, starting with the life cycle, in both the cases, definitive host is the human. Taenia saginata or Taenia solium. Definitive host is the human. And the intermediate host is your pig in case of Taenia solium, and it similarly cow in case of saginata. In both the cases, adult is present in your small intestine. So from this, what comes out? Egg. These eggs are taken by the cow or pig. They enter into the body of cow or pig. Then the egg will hatch out, and what comes out? Oncosphere. There is one structure. Just a minute here. So from the egg, what comes out? Oncosphere. Oncosphere is having 1, 2, 3, 4, 5, 6 hook. This oncosphere hatch out inside the body of cow or pig, and it will enter into the muscles. If these muscles, which we call as beef or pork, they are eaten by the human, that is uncooked or raw, then it will enter into the body, and that may lead to the infection. So the source is uncooked beef or pork. There are two terms which are related with this, known as measly beef and measly pork. So this is the life cycle of the Taenia, saginata and solium. One more difference is this one. From the small intestine, eggs come out, or they directly enter into this. So that is the feature of Taenia solium. We call it auto-infection. So the life cycle begins with egg comes out, and these eggs, these are eaten by the pig or cow, hatch into the oncosphere. Oncosphere reaches into the muscles, that is beef or pork, eaten by the human, and the adult reaches into the small intestine, then keep on excreting in the eggs. That egg may be contaminate the environment, eaten by pig or cow, or these eggs may, in case of solium, these eggs may be infective for the human itself, auto-infection. So this is about the solium and saginata. So once, okay, one more thing. What is present inside this beef and pork? In case of pork, what is present? Cysticercus cellulose. In case of beef, what is present? Cysticercus bovis, because the muscles contain larvae, these larvae, bovis and cellulose. In case of Taenia solium, these Cysticercus cellulose or bovis, they may cause, if they enter into the brain, they may cause neurocysticercosis. If they may enter into eyes, they may oculocysticercosis. So wherever they enter, they may cause pressure on that area. So that may lead to death of the human being. So neurocysticercosis, ocular may lead to the blindness. That may lead to blindness. So this was the MCQ. The neurocysticercosis is related with which tinea? That is sodium. So next is your tinea multiceps. Okay. With tinea multiceps, what is the larval stage name? That is Sanurus cerebralis. It means this is related with the cerebral system. This is related with the CNS. So in case of this tinea multiceps or Sanurus cerebralis, cyst will be formed. What is formed? Cyst. And that cyst, depending on its location, in 2019, they have asked one MCQ that I am explaining with this human diagram. Suppose this is the brain. Okay. Spinal cord is your cerebellum. If the cyst is present here, number one, if the cyst is present in cerebellum, cerebellum control all our movement activities. That may lead to jerky or staggering gait. If the cyst is present somewhere here, like this, spinal cord, this part of spinal cord control your GIT, rectum, control your bladder, control your hind limbs, control your hind legs. So all these structures get paralyzed if the cyst is present at the site of spinal cord. If the cyst is present, it is distributed like this, scattered. That may lead to pressure on the optic nerve, and that may lead to your blindness. Suppose if the cyst is present on this surface is known as parietal surface. This is your parietal surface. If the cyst is present here, that may lead to movement, that may lead to circling movement. Circling movement occur on the affected side. So these are the areas where cyst is present, and according to that your neurological signs appear. So these four, which of the following is true about the cyst? And it was a kind of match the following MCQ, where you have to match. Okay, cerebellum present, it is with the jerky movement. Spinal cord, then paralysis of hind leg. Scattered, blindness. Parietal surface, like circling movement. So it was match the following type of MCQ with the, and this disease is known as, in case
Sir,
of
blindness
sheep,
is due to
blindness is due to pressure on the optic nerve. If you damage the
the
optic
cyst
nerve,
is present
the
in
animal becomes.
where the cyst is present in case of blindness.
If the cyst, see, if you look at the path of your, these are your eyeballs. Okay, eyeballs on both the sides, optic nerve. Then what comes? Suppose this is second eyeball. So this is the structure of your visual pathway. These are two eyes. Okay. These are two optic nerves. When they combine, we call them optic chiasma. Then they divide into optic tract, and these optic tract, they enter into the portion of the brain which is this side, what you call visual cortex. Also, there are some other optic radiations. So this is the pathway of visual system. If your cyst is scattered, like here, it will compress. If cyst is here, it will damage. If cyst is here, like your chiasma, it will damage. Cyst is present here. If cyst is here, or at the visual cortex. So in the path of the optic or visual pathway, if you damage at any point, animal will be blind. So if the cyst is scattered like this, blindness will be there. So next is Echinococcus granulosus. That is your dog tapeworm. What do you call it? Dog tapeworm.
Sir, gid.
Gid, that Taenia multiceps, that was known as gid or stagger. This is because of the formation of that cyst, and that gives your neurological signs, and these neurological signs may be known as stagger or gid. So Echinococcus granulosus and multilocularis. There are two tapeworm. What is the only simple difference is this? One is known as granulosus and one is your multilocularis. So in case of granulosus, definitive host is dog, or definitive host is dog, and the more important one is intermediate host. Here the intermediate host is rodent. So this is the intermediate host, which is known as rodent. In this case, there may be cattle or sheep. And what they cause? Hydatid disease. And the larval stage is known as hydatid cyst. That is your hydatid cyst. In both the cases, so Echinococcus granulosus and the difference is because of intermediate host. In the module, there are two cycles are shown. If you find in granulosus, only cattle and sheep picture is given. In this case, rodents are given. So, beginning with this life cycle. In case of Echinococcus, dog is present. That is your dog, definitive host. Then we have cattle and sheep. Cattle and sheep. In the body of cattle and sheep, cysts are formed. And these hydatid cysts have two layers. Outer is laminated, inner is germinal. So why germinal? Because something is germinating from this. If you look at the structure of the parasite, there is scolex and the four segment. This is the head, scolex. To form the scolex, inside the cyst fluid, what is present? Protoscolex. Protoscoleces are present. And then there are some more structures, what we call it brood capsule. So in case of cattle or sheep, they have asked, out of these cysts, which cyst is fertile? That is of sheep, and which is sterile? That is of cattle. Means no protoscoleces present, these are present. If protoscoleces are present, these cysts are eaten by the dog, then these protoscoleces, they will attach with the intestine and become scolex, and then remaining part will form. Then what comes out? Egg. From the egg eaten by these, and inside their body, what is formed? Cyst, hydrated cyst. So this MCQ was asked that in case of sheep, most of the 70 to 80% cases, their cysts are fertile, and in these they are sterile. And who is the definitive host? Your dog. The echinococcus, what we call a dog tapeworm. So how to check? There is one test, what we call is, there is one test, Cazzoni test. Cazzoni's test. In this test, this is the cyst filled with the fluid. We remove the fluid, and this is skin, and with the help of this, we inject this and check for the hypersensitivity reaction. So this test will tell you about the hypersensitivity reaction. So this fluid, it contains antigen. What is the name of antigen? That is antigen B. One more antigen, ARC5. This is more specific antigen B. One more is ARC5, that this is more specific antigen. You will find this antigen, inject it, hypersensitivity type 1 reaction. This is your Cazzoni test, known as intradermal hypersensitivity type 1 test. And the treatment is, because it is a cestode, so praziquantel, and they also use albendazole. Next is your Dipylidium caninum. Dipylidium caninum. The more important MCQs about this is the intermediate host, flea or lice. This infection is not by their bite. This was the MCQ. That which of the following cestode or parasite having mode of infection known as ingestion of intermediate host. It means this is the fly. Okay, this fly will be eaten by the host, not by the bite of the lice or the fly. This is the Dipylidium caninum. The more MCQs about the Dipylidium caninum is about its some morphology. The segment of this Pylidium, they are cucumber seed shaped. This was MCQ in ICAR exam. That which of the following tapeworm having segment just like cucumber seed shaped? So the definitive host for this is dog, and it is also known as the commonest tapeworm of dog, because on the body of dog what is common to found? Flea. So we call it commonest tapeworm of the dog. And one more MCQ about this. From the body of the definitive host, from the body of what comes out? This gravid segment. These gravid segment, because they are motile, so in the area of the anus, when they come out, at that time they cause irritation. Because of this irritation, the animal try to drag the anus on the ground, just like okay. So this is the MCQ related with your Diaparidium canina, that these gravid segments, they are motile, and when they are coming out of the anus, they cause the irritation in the perianal region or area. Because of that irritation, it will drag its anus on the ground. Then there is one more family which is related with only poultry. Just in case of trematodes, there was one fluke related with the poultry, that was Prosthogonymous fluke. In this Cestode, Davinia, there are three members, that is DRC, just like dose response curve. So D for Davinia, R for, that is Rhylatina, and C for Cotognia. This is the most pathogenic tapeworm of poultry. DRC. R is the second most pathogenic of the poultry. This Davinia causes hemorrhagic enteritis, and this Rhylatina causes nodule formation in the intestine. So these were two pathogenesis related with the Davinia and your Rhylatina. The most pathogenic is Davinia, and the second one is the Rhylatina, and their pathogenesis is hemorrhagic enteritis, and with the Rhylatina, that is the formation of nodules. Then there is one more family where you find the Cestode of horses, Anaplocephala. There are two members, one is magna and one is perfoliata. They have asked two MCQs, that size of magna, this is maximum size, that is 80 centimeter, and this is a small, that is having 8 centimeters. So perfoliata is, there is one structure with the head that is known as Lappet structure, LEPPET. It is present here and absent in this case. So the magna is also known as the largest tapeworm of the horses. The other difference between these two is their site, where they cause pathogenesis, and that is ileocecal junction, and in this case only jejunum. So at these sites they cause their pathogenesis, and what is that? That is enteritis or ulcers. So these are magna or your perfoliata. Then there is one Monagia. This is related with your herbivores. With the Monagia, there are two MCQs. One is Benedini, one is expansion. In between two this proglottid, there is some structure is present, some glands are present. If these are just like a band, what you call Benedini. If these interproglottid, these glands, they are present like a ring, what you call expansor. So this is the difference. Second is Monagia contains one apparatus which is triangular in shape. We call this piriform apparatus. And the egg of this Benedini and egg of this expansor, they are also different in the shape. This is square shaped and these are triangular shaped. So they have asked these MCQs also. That in between two proglottids, the glands are there, band shape, ring shape, and egg is square and triangular. And these are the herbivore cestode having one important feature, that is piriform apparatus. And about the intermediate host, as these are the true cestodes, they have only one. And in this case, that is very important to remember, that is ORI, oribated mites. These are the intermediate host in case of Monagia. Then there are two more cestodes. One is A. vitellina and one is Stilesia. In ICAR 2018,
Sir,
they have asked one
sir,
MCQ.
sir,
Yes?
definitely host in both Monacia and Benedict, the expanse is same.
Yes, they are the tapeworm of ruminant. You can say ruminant. Both are same.
Okay, cattle, sheep, separate.
Yes, yes. The definitely host is ruminant. So, in case of Stilesia, there are two species. One is the hepatica. In the name itself means liver, the site will be bile duct. Bile duct. So we call it a tapeworm which is present in the bile duct. But in 2018 the question was this: globi punctata. That which of the following species of Stilesia affect your cattle and sheep intestine? This was the MCQ. So answer was Stilesia globi punctata, because this parasite is present in the intestine, cause enteritis in case of cattle and sheep, and this is present only in bile duct. And if you look at the A. vitellina, this A will tell you for MCQ. A means absent. What is absent? Vitelline gland. Second, A is the first letter of ABCD. So this A will tell you that there is one uterine organ. And again A means one. What is one? There is only one genital organ. There is one set of genital organs. So these are three MCQ with your A vitellin, no vitellin gland, one uterine organ, and one set of genital organ. In case of Stilesia, you have two uterine organs. Sometimes they are small morphology also. So these were some important cestodes previously asked in your exams. So if I summarize all the cystodes. So I will divide into two. One which are having intermediate host, how many? Two. One which are having intermediate host, only one. So dilatum, your dilatum and spirometra, these two are having two intermediate hosts. Okay. So in case of dilatum, we have cyclops, we have fish, and here if you look at the tinea, that may be cow, that may be your pig, and like this. So this is the summary where we divide the cystode into two parts, one which are having similarity with the trematodes, means their egg are operculated, they are unembryonated, they are yellow in color. But here we find different types of cestodes with different types of morphological features. Like Echinococcus having two components, one is your granulosus cyst, then your multiceps. With the multiceps only the CNS signs are important. Then your Monagia benedini expensa, Tavinia, that is the most pathogenic of poultry. D. palladium caninum, they are asking only the one MCQ, that is dragging of your anus on the ground. If the same MCQ, okay, if they ask you dragging of anus in case of dog, okay, your answer will be Dipallidium caninum. If they ask same question, dragging of anus in case of horse, then there is no cystode, but there is one nematode. There is one nematode. What do you call? Oxyuris equi. Oxyuris equi. So there are two MCQs which is related with this term dragging of anus. If they change the host, if they ask you about the dog, caninum, horse, that will be your nematode, Oxyuris equi. So dragging of anus. Then with the motile segment, gravid segment, there are two MCQ. Gravid segment which is motile in nature. So remember tinea, saginata and D. caninum. These are two. If they ask you in which of the following parasites the mode of infection is ingestion of intermediate host, there are two. One is this D. caninum, eating flea and lice, and the another is not a cestode but that is a protozoa, that is called Hepatozoon canis, and in that case ingestion of intermediate host which is nothing but ticks. So there is ticks and these are fleas and lice. These are caninum and this is your Hepatozoon canis. Both the cases ingestion of intermediate host. And gravid segment which are motile, saginata and caninum. Why? If this is motile caninum, that may lead to anal irritation, dragging of the anus. So these are some important point about trematodes and cystodes. If you have any
Sir,
doubt,
the shape of hooks is important in
yes,
cystode.
very shape. Yes, I told you no that in case of saginata, they have said tata to the hooks, means tata bye bye. No hooks. In case of saginata, there is no hook. This was the MCQ. And there was another MCQ in 2019 that which of the following is characteristic of the family Anaplocephalidae? Like this. Absence of these hooks. Hooks are absent. So morphology is also important because in some parasites you will find motile segment. Some are having absence of hook because these are the hooks. They help in attachment. So morphology is also important. And with these your trematodes, remember only no need to remember the color of egg, but just remember this trick like your toes. Dicrocilium, Opisthorchis, Cystosome. These are embryonated. All the rest are anembryonated. Your dilatum is anembryonated, similar to this. And all the larval stages of your trematode, like Merasidium, which is present in which species, absent in which. And if there is one common MCQ, that drug of choice for Cestode, the answer will be praziquantel. So which of the trematode is having drug of choice praziquantel? Then answer will be cystosome, because they differ in every aspect with the other members. And
So that rose thorn shaped hooks.
rose thorn house, they are present is your Dipylidium caninum, just like rose. If this is the head, this is the plant of rose. What comes out? These are hooks. These are the hooks of rose plant. Similar hooks are present on the head of the your caninum, Dipylidium caninum. What do you call these? Rose thorn shaped hook. This. So this is just in morphology. More you memorize, more it will be helpful in solving the MCQs. So in trematodes, cestodes, this much is sufficient because most of the questions are asked from this portion only that I have covered. If you want to read something else, you have many books you can read. But these are the most important ones. They are asking again and again. So tomorrow we will start and finish our chemotherapy. That is very simple in case of pharmacology and very, very volatile subject. If you read today, tomorrow morning you will forget everything. So the formula to remember chemotherapy is regular daily practice. This is just like mathematics. If you remember the classification of beta lactam, this, next day if you forget. If you regularly read these examples, you will remember. Otherwise, chemotherapy is the most volatile in pharmacology. General pharmacology is 95% conceptual. Only 5%, like which is enzyme inducer, which is the example of this ADR type D. Only few examples are there. At least hardly 10 to 20 examples. Whole theory is about concept. Chemotherapy is just opposite. It is 5% conceptual and 95% you need to memorize. There is nothing in chemotherapy other than रट्टा मारते रहो बैठ के. And in systemic There are some concept and examples also, but that is good. But toxicology is also a small sister of your chemotherapy. There are many examples and less concept. So tomorrow we cover chemotherapy. So this finishes our trematode and cestode. If you have any other difficulty or doubt, I will make one 5 to 10 minutes video and will upload on the group. So don't worry about this that something is left in trematode system. This is all about whatever you learn, memorize. Because if you look at the life cycles, they are mostly same. In all the trematodes, what is common thing is this is your definitive host and first intermediate and second intermediate. The story of cycles run in this manner. And in case of cestode, we remove the second also. And the whole story runs in between definitive host and your intermediate. So this is your cestode, only one IH. If you add one more intermediate host, it will become trematode. So try to revise the concept through some comparative points, like this second intermediate host similarities. Fasciola have plant, Buscae have plants, Amphistome have plants. Like then, which of the following has same egg, dilatum, fasciola? Then which of the following have similar mode of ingestion, D. caninum, Hepatozone canis, and other like which is having motile segment. So in ICAR exam, they will ask you in comparative manner that this trematode is having some feature which is matching with some cestode. This is the cestode having some features with similarity with this another cestode, like this. Egg of this matches with this, or gravid motile of these two. So they ask like this. They will not ask you that what is the definitive host of this one. What is the entry now? But if intermediate host is something different like dragonflies, so they will ask. But in trematode modules, I have covered all the ICAR MCQs last 5 years. There is nothing left. So I think this much is enough for today's class.
Thanks, sir.
Thank you. Thank you very much.